You got it.
Hi, I'm Sue Robotti, and I'm the founder of, of Facebook Live. I'm the founder of MedShaodw, which is a not-for-profit and independent health news resource that focuses on the side effects of medicines and helping our site visitors determine whether they want to take that medicine, how they're going to manage taking medicine, or what alternatives they might have to taking that medicine. This is...
I'm Jonathan Block. I'm the content editor here at MedShaodw.
Great. Today we're going to talk about 23andMe because Jonathan wrote a blog on it, and he's full of information and he just can't stop talking about it.
Right.
But for those who don't know 23andMe, it is it tests your DNA. You spit into a little vial, you cap it, and you send it off to 23andMe, and they do a genome sequencing process.
Genetic testing, in other words.
Genetic testing. And based on your DNA, they tell you where your family came from and what characteristics you're likely to have. I did this myself, and I found out exactly what my family always knew. We're a mutt. I am 1/4 English, 1/4 Irish, 1/4 German, and 1/4 Danish, which represents each of my 4 grandparents exactly. It told me I would probably have blue eyes. I do. And it told me I'd probably have light brown hair. I do. Have you ever done 23andMe?
No, I haven't, although I like the idea of using it to find out about your family's heritage. What's new about 23andMe, which is going to be the focus of our chat today, is the fact that 23andMe, besides doing the genealogy tests, they can also do genetic tests that can test to see whether you're at risk for certain diseases, and their most recent tests can test for if you have a higher risk, of developing breast cancer, ovarian cancer, and in men, it could also use to see if you have a higher risk of prostate cancer and breast cancer. And yes, men can also get breast cancer.
Doesn't it include Alzheimer's risk?
Yes, they have a couple of tests. They had one for Alzheimer's that came out last year, and this new one, it was just approved by the FDA about a week or so ago.
But just because you get this test back, and it may or may not say that you have a higher risk or lower risk for breast cancer or Alzheimer's, it doesn't matter. If you have a 1 in 100 risk, you might be that one. You might have a 90 in 100 risk, a 90% risk of getting something. But if you're in that 10% who doesn't get it, you don't have it.
That's right. One of the interesting things with this new test, the one that works for those various types of cancer, is that it tests for 3 genetic variants that may increase your risk. Just to let you know, there are about 1,000 genetic variants that may increase your risk for certain types of cancer. So they're only testing for 3 out of 1,000. That's the first thing. And the other thing is that most of the people that have one of these 3 genetic variants tend to be Ashkenazi Jews. Those are Jews that come from Eastern Europe, which happens to be someone like me.
That DNA strain, if it's in your family background, tends to lead to a higher risk of breast cancer.
That's correct.
Okay, because phrasing is everything here.
True.
There are no absolutes.
Correct.
And this is a testing facility that is, I don't know, are their tests accurate? How do you even know?
Well, it depends what you're talking about accuracy. They're going to give you an idea of your risk, but then you have, well, what does that risk indicate? Because the risk is, again, only based on 3 out of 1,000. So you could say, oh, yes, your risk is quote-unquote high, but that can mean that, number one, you never actually develop a type of cancer, or B, you don't know what your risk factors are based on those 997 plus other genetic
So
variants.
I think this whole, even though I did it, it was entertainment for me.
Yes.
I think the whole thing's rather bogus. I think that everybody who is concerned about breast cancer should talk to their doctor about the benefits of getting a regular mammogram or getting an every other year mammogram or breast exams, physical exams. Anybody who's worried about getting prostate cancer should talk to their doctor about the pros and the cons of prostate cancer. We have an excellent article coming out in 2 weeks about the pros and cons of prostate cancer. So
the prostate cancer test, which is known as a PSA test.
PSA test, yes. But you like 23andMe.
Yeah, I see, and maybe I'm a little bit prejudiced because, as I just mentioned, I'm an Ashkenazi Jew, so this test is particularly important to someone like me. But I feel that there's really nothing to lose. Yes, you should obviously talk with your personal doctor about cancer risk and your personal risk, but I don't see any problem if people want to spend the money to go and take the test. I just think that they should have an understanding that that if it comes back that you have a high risk, that doesn't necessarily mean that you're going to get breast cancer or any of the other types of cancer. And on the opposite is that if you come back where it says your risk is very low, that doesn't necessarily mean. But I think that if people want to do it, if they want to spend the money, why not? It's a free country. Let them go for it.
Well, yes, but I think you're wasting your money. There is recently an article, a study that came out in the Annals of Internal Medicine that it was a very small study. It was a very short period of time. It is not conclusive, but it took, it took a bunch of physicians who volunteered for the test, I mean, it wasn't a perfect test, and gave them, I think it was 50 hours of training on genomic sequencing and how to interpret it and how to incorporate it in your role as a clinician in the examining room with your patients. Mm-hmm. And then they took 100 patients and they divided them in half, and 50% got the genome sequencing, the DNA testing. It didn't say if it was 23andMe or a different lab, and 50 people did not. They sent them in, and the doctors did a regular case history, family history, examination, and those who had the DNA sequencing, it only popped out 2 rare diseases they would be at higher risk for. It changed absolutely none of the clinical care for a person. Mm-hmm. All it did was increase worry and anxiety in people who were at a higher risk, mm-hmm. and perhaps it gave a false sense of comfort and maybe might lead to a lack of follow-through for those people who are at low risk.
Yeah, I don't necessarily disagree with you. However, you could also look at it that in some people, if they get the test and the test comes back with a high risk, it might prompt a conversation about it with their healthcare professional. So yes, you're going to have some people who might, for lack of a better term, freak out about it. Mm-hmm. They really shouldn't. But then there's going to be other people who are going to get the test. They're going to say, oh my goodness, I didn't know about this. I should really talk about this with my physician.
Somehow it seems the people who are going to take the test are ones who freak out anyway. Well,
maybe.
Or who are medical
Perhaps,
nerds,
we
which
don't
I
know,
was
but
just
yes.
told today. I'm a medical nerd. Who knew? Or a drug nerd. Which am I? You told me?
I think you're a drug nerd.
How boring. So we'll end on
Yes.
one story that I get to tell. When I took the 23andMe test, my husband did it at the same time. It was my birthday gift to him last year.
Oh.
So we, spit into our little vials. You seal the
How
little
romantic.
cap. I know, spitting, yes. And we mail it off, and I think it takes 6 weeks. It's a long time. And mine comes back and tells me exactly what I expected it to do. His came back and with a note that said, this very rarely happens, but there wasn't enough DNA in your spit to read your sequencing. Mm. So here's another kit, and please do it again. So it sat around for a few weeks, and finally he got around to, you follow the instructions, you have to not have eaten or drunk water for a certain period of time, and he made sure he did that, and spit, seal, send. Oh, that could be their slogan, spit, seal, send.
Copyright it now.
Yes. And it took 3 months, and it came back and said, yeah, we can't get any DNA out of your spit. Please don't try again. So
he has some very special
he's
saliva then.
We think he's an alien.
Could be.
I know, he's not from this planet.
I have seen him glow in the dark occasionally, so you never know.
Anyway, use your good common sense.
Exactly.
If you have a family history of a disease, it doesn't matter that 23andMe says that you have a low risk for it. If you have a family history, you want to be tracking it.
Right.
If you don't have a family history, don't panic if anybody tells you you're suddenly a high risk for just because you spit into a vial. It's fun. do it if you like. I would skip it next time.
Right, and if you do have any questions about your risk for breast cancer, for Alzheimer's disease, or for any other disease or condition for that matter, I would first talk to your primary care doctor about it and then go from there.
And come to MedShaodw.org to read Jonathan's blog on this, which was very organized, unlike our discussion.
Exactly.
Thanks.
Thank you. Bye-bye.
Bye-bye.